All right, so if you've taken to doing DIY eye checks at home, where you're trying to figure out how stable your eyes are by looking at targets, you might notice that they shake. But it can be normal-ish if you can get all the way to the edges, and eventually your eye fatigues and starts to shake. Where we start to actually pay attention to it and look at it a little deeper, it's usually right around 20 degrees. So we have people come over to 20 degrees and hold in all directions. And what we're looking for is to see if the eyes start to drift. What we'll normally see is if they're getting weaker, if they're tired, or if they're hypometric. The eyes will start to drift back toward the middle, and then they'll quickly move back over to the target, and they'll drift back to the middle and quickly back over like this. That's kind of like a hypometria. But another thing that can happen, the eyes, when you're trying to hold them over there, they'll actually do these little jerks. And sometimes they're big jerks, and sometimes they're little ones that oscillate like that. And we call these square wave jerks or square wave oscillations. And it's important to be able to differentiate what's a nystagmus or a drift versus when we see these square wave jerks, because they can come from two different types of problems. So if you're doing it at home and you're cranking your eyes all the way over, you're going to freak yourself out, stop. But if we're looking at it in a tighter range, we want to be able to hold in that 20-degree range with our eyes being able to be still without having them jerk around.